Hey, ma'am. Good morning. Ma'am.
Yeah, Suraj.
Hello, ma'am. Can you hear me?
Yeah, Suraj, I can hear you.
Ma'am, I hold you the and Mr. Ravi is there. And
Okay.
when Mr. Kasim joins, we will open the floor for others.
Okay, fine. And then we can just close it after the session, right? Nothing else to be done. The recording will be on. It's on.
Yeah, recording is on, ma'am.
Yes.
Only thing
Yeah.
is like I'm waiting for Mr. Dr. Kasim to join. So once he joins, we will add others to the meeting.
Okay.
Okay, doctor.
So there is more, but that's the idea. This is the two, day one, two. This is Malaysia, this is China, Bulgaria.
to Dr. Salah, he wanted to add. And then Dr. Salah said,
I replied, we'll do it.
no.
Okay.
Hello, sir.
Hi.
Hi, sir. How are you? Are we as now as attendees, or we are panelists?
Yeah.
So you have almost now 20 people, sir.
But where is the hero?
Hero would have just got in. I hope so.
Yeah. Okay. Damn.
He's not joined?
I can't search him in the participant list.
Is not there. Yeah, he's joined dancing.
Yeah, he's online.
Where is he?
So you can search in
Join.
participant list.
Joining.
Ah. We were just waiting for the hero.
Hi, Kasim. I think
Welcome,
he's
Kasim.
still muted. Yes, he is now online. Hi, Kasim. How are you?
Yeah, doing well.
Hi.
All okay?
The hero is here. The hero is here. Our hero is here.
No, far from it.
No, Kasim. How you been doing?
Yeah,
Nice to see you.
yeah, it's good. Good to see you too.
Yeah,
Been doing okay. Just very busy over here. I mean,
I understand. I understand that.
things have settled down with regards to COVID, but I think at the moment just on a busy job on the renal department at the moment. So very sick and complex patients. How's the uni been?
The unit has been doing good,
Okay.
and Professor Amanda is also around. So he is doing good, and we're getting a lot of accreditations coming up. So we're doing very well. We've been ranked second in UAE, right, sir?
I saw that. Very good.
And we are in 400 to 600 universities, global universities ranking in medical schools. So we're doing good with a good leadership of Professor Hamdi and Professor Amanda and all the good team members. We're doing very well.
Congratulations. I mean, I've seen
Thank you.
all the work you guys have put in,
Yeah.
tireless hours, going into it. So it's good. You've earned it. It's you guys have worked hard.
Right. So shall we start? How is it? Like we are okay on it, Dr. Priya?
Yes, sir. Shall I introduce Dr. Qasim to the students?
Sure.
Okay, so I have great pleasure in introducing Dr. Qasim Raw. Most of you would be knowing him. For others who have not met him yet, Qasim graduated from our university in 2019. I remember him as a very motivated student who performed very well, not only academically, but he was involved in all the extracurricular activities at the college. And he was in fact the former General Secretary of the Students' Council. And currently he is doing his foundation training in the NHS as a junior doctor in the nephrology department at the University Hospital of Leicester, England. I hope I pronounced it right, Qasim.
Yes, brilliantly.
Yes. So this session was much in demand from the students. I was ambushed in the corridors, bombarded with mails. Okay, just exaggerating, but you get the gist of it. So it was much in demand, and I'm very sure they're happy it's happening. So now over to you, Qasim. Would you like to start?
Yeah, sure.
Yeah, before
Dr.
Qasim starts, before Qasim starts, I just want to say a few words. That was a very formal sort of an introduction to Qasim. Yeah, that was needed, but I wanted to tell something. Definitely, without telling something about Qasim, the day won't be complete. Priya was telling that yes, there was a lot of demand now. Basically, career advising sessions. This is a career advising session basically for the medical students, and we invite our valuable alumni to come and present their success stories and guide you, and so that they are resource persons for you to progress in your careers. Now, Qasim has always been connected with us. So this one thing which stands apart, that always he is connected to us, and he is an ambassador for the university, for the college, for the program. And second thing is he has also thanks Qasim for being for accepting to be on the advisory board of the MBBS program. So because students complains a lot, but alumni actually realize the worth of what has been done generally. So alumni praise a lot and students complain a lot. So if you don't complain, you're not students. If you don't actually realize what it is, what you've gone through, and when you're on your own, you may realize the real worth of what you underwent. So I'm sure that will be reflected in your talk today. But we value our alumni, and we would go out to support our alumni and our students, and we are doing our best in very challenging times. And I also thank Dr. Priya for doing this wonderful work of coordinating the career advising sessions for the college and for the MBBS students, right? So with these few words, as I told you, Dr. Qasim is very dear to us, and thanks to get some time out from your busy F1 schedule, and in this challenging times to come and talk to our students. Right? So thank you so much, and I think you could proceed with your presentation. Thank you.
Very much for arranging this. Thanks for having me. It's honestly a pleasure to give back. And I do want to say what I do want to say is that if I'd like to see some students in the world succeed, I would definitely prefer it to be students from my own university, which is one of the reasons why I'm doing this talk as well. I mean, being in GMU, it was a long 5 years, and I've definitely seen the uni grow. And I feel that all of the students who actually come, to GMU or start a career in medicine or whichever program that you're in, you have goals. You have goals in life, places that you want to reach, and so the fact that we're all a team on this, and we all need to guide each other, so I definitely think that this should also reflect throughout the next few years. I mean, you guys, time is going to fly, and you're also going to be in your fifth year, in your final years. So I would definitely advise that you continue this whole aspect of teaching others, because the whole healthcare system right now in the world has changed a lot, and there's a huge impact and focus on teaching your own peers, and that's also basically part of my training at the moment in the NHS. Anyways, so where should I start? So I'll give you a brief introduction of what I'm doing at the moment. So I'm currently doing my FY1, which is the foundation training program here in the UK in Leicester. And I started this program back in August. So that was basically around the middle to the end of the first wave of COVID. So things were very busy back then. And I started with oncology, which is a cancer-related specialty, very complicated. I found it very, very overwhelming and daunting in the beginning, you know, being fresh out of med school and being thrown into cancer, you know. But I truly feel that is how you learn as a doctor. I think it's very, very important for you to step out of your comfort zone. And it's very easy for you to get comfortable. For example, me back in Dubai, you know, I was very comfortable. I got very comfortable with what I was doing, and I felt that I needed to step out of my comfort zone and come here and train. Anyway, so I finished oncology. That was a very good learning experience, and then I moved on to urology, which is a surgical specialty. And that was mainly focused on surgery and urological cases. With my role as an F1, I would basically be doing a lot of catheters, which was fun. Glad to say I'm quite good at putting catheters in now. And these are all skills that you realize the importance of later on down the line. So yeah, that was urology, and now I'm in nephrology, which is the renal department, and this is shown to be very, very different when compared to urology and oncology. Patients are extremely complex. Some of you preparing for the USMLE, a lot of the cases that you guys would see in your exams, a lot of these cases you would actually see in these departments. And so yeah, so that's where I stand at the moment. And also, I think I should tell you a little bit about the foundation program. So the foundation program, it's a very long-standing training system that's been developed in the NHS. And so how it basically starts is it's a 2-year training program where you start as a provisionally registered doctor. Right, so you're starting as a doctor. It's a 2-year program that basically makes you fully fledged and able to start training in a specific field. Now, a lot of people compare it to an internship, but in my honest opinion, I don't think that it is. I don't think you can compare them together, because as an intern, you generally would be more so supernumerary in the sense that the hospital would technically be able to function without you. Whereas in the foundation program, you see, the whole NHS system is built around this training program for doctors. So what I'm trying to say is that a hospital would not be able to function without foundation doctors. You know, so as a foundation doctor, you are technically the machine that runs the hospital. Obviously, the consultants are the brains, and they're the brains of the whole of the whole system. But we would actually be doing all the jobs. So as a F1 doctor, you will pretty much be doing all of the things that you guys would have probably learned in your 4th and 5th years, and a couple of other things a little more complicated. There would be a lot of administrative work in the sense that there would be a lot of typing and computer work involved. So for example, let me give you an example of a basic day of an F1 on call. So I would say that urology was probably, so far, it's been the most demanding with regards to actually being a doctor. And I do also want to say is that as an F1, as a foundation doctor, you are very well supported by your senior staff. So you can always ask for help. And that's a phrase that you hear a lot in the NHS. You will always hear that phrase: ask for help, ask for support. You know, don't do anything if you don't know how to do it. So yeah, so technically you are. It feels like you are thrown into the deep end, okay, which you technically are, but at the same time you have a lot of support. Now, so a typical day as an F1 doctor on call, let me give you an example of my days in urology. So if I would be on call in urology, I would basically be taking referrals from other doctors, such as GPs. So they would call me up and say that, look, we've got this patient. He's got this problem, he's got that problem. Can you accept him into hospital? So you are technically the doctor who accepts that patient to come into hospital. And that, I mean, when I heard about that, you know, that was very daunting. You know, it was very intimidating, you know, to actually be the doctor who actually accepts the patient. So that there is a lot that can be expected of you. And I'd say a lot of these things I hadn't done. Obviously back in university, you know, you don't learn about it, you know, taking referrals and accepting patients. But the thing is that when you are under this pressure, you definitely do learn very, very quickly, and you adapt very quickly. So also I do want to say that as an international student, if you're coming from abroad, when I first started in oncology, there was a lot of pressure because I didn't understand the system that well. Meaning I hadn't spent a lot of time in NHS hospitals. So their whole infrastructure is very different. So, you know, it takes some time for you to adapt. But definitely I can tell you that it's possible, as I've done it and so many other people before me have done it. So I don't think there is any problem with international graduates going abroad. So that was pretty much that would pretty much be a day as an F1 on call, taking referrals, seeing a lot of patients, a lot of the things that you learn in uni, like history taking. Those things would definitely apply because you are clerking in a patient, which means that you are seeing the patient, you take history from them, you examine them. So all these things finally come into play. And you don't realize all these foundation aspects. I mean, this all goes into the background, you know, history taking, examination skills. This is actually the foundation of being a doctor. But it's funny that you forget about that and you start, you know, going deeper into things, trying to think what the patient actually has, trying to take blood from the patient. So taking blood is probably one of the biggest things an F1 has to do. You are constantly taking blood from patients. You have to do venipuncture, cannulations. All these things are golden skills
انتي بس بريطاني
for being an F1.
هذا بابا he's the smartest guy in our university.
عن جد؟
هو كان our university's ambassador.
كيف تتخرج؟
من عندك last year.
I think
he was the top of everything. Okay, so what? Okay, he's just good at social work. This is not
Hannah.
Then can all of you just mute yourself?
Can everyone mute, please?
Hey guys, make sure make sure you're muted. We'll pretend that we didn't hear anything. Anyways, as I was saying, swiftly moving on. What was I saying? So yeah, so taking of blood and cannulations, etc. These things you learn in 3rd and 4th year. These are extremely important. So I want to highlight that as well. And yeah, so that's pretty much it. We can talk a little later on about more about what you do in as F1, but I think now I'll start talking about how you can actually go and get accepted into the foundation program. Now there's a link or a website that you guys should definitely look into if you do plan on doing the foundation program. Now those of you who are in 5th year at the moment, it's fine. So it's 28th of April. I mean, there is time. Ideally, your preparation should start earlier, but April is decent enough time if you guys do want to go to the UK. Now, the first thing I would say to get sorted out the way would be the IELTS. And sorry, let me just tell you that website. So the website is, if you go on Google and you search UK Foundation Program, there should be a website that comes up, which is called the UKFP. You click on that, and what you guys need to look at, or us as international graduates need to look at, is it's called the Eligibility Applicant Guidance. Okay, and that is your file. So the 5th year students who would want to apply for 2021 foundation program would need to click on UKFP 2021. It's very clear on the website, and you need to look at eligibility guidance. Now what that means is, so how it works is the 5th year students here in the UK, they go through their years of med school, and while they are in 5th year, they will start the whole application process to the UK foundation program. Now, one problem is that we as 5th year students in the UAE cannot do that. Reason being because we have to sit an exam which is called the Plab. So you've got to sit that exam, and for you to be able to sit that exam, you have to have passed your 5th year.
He has long hair.
Yeah, I have long hair. Could you mute your mic, please?
All the students, please mute yourself. You can unmute yourself when you want to ask a question, but for now, please mute yourself.
We'll have a question session at the end, but guys, if you could just please make sure that you've got yourselves muted. Okay, so I'll go ahead now. And what was I talking about? Yeah, so the Plab exam. So basically, when you go through 5th year, for you to be able to sit the Plab exam, you would need to have completed your 5th year, which is the problem, which is what causes that gap. So ideally, you would do your 5th year, okay, sit the Plab exam, and while sitting the Plab exam, you would what's the word? You would start your application into the foundation program. For UK students, this happens automatically while they're in 5th year, but we have to put a little of our own effort when we are 5th year and plan basically what to do, plan our whole steps ahead. So fine. So then you would ideally apply to the foundation program, sit your plabs as well in the meantime, and go through the whole process. So as international students, you guys would need to look at the eligibility guidance, which is on that website. So when you look at that, you've got a whole list of dates, you've got a whole timetable that's very clearly arranged for you. Definitely go through that when you do have the time. And the first thing that I think we would all need to sort out would be the English requirement. So you've either got the IELTS or you've got the OET. Now, when I applied to the foundation program, they only accepted IELTS, and the requirement for English was quite high. I believe it's a 7.5 in each category. But I do believe that I've heard that the OET is a little more. I've heard that it's easier. So whichever one you guys can have a look at the requirements, and I think the OET is like a 400. But anyways, these English requirements are quite they're quite important if you want to go abroad. So ideally, you have to sit the IELTS, and as well, just so you know, the Plab exam also has IELTS or OET requirements, slightly lower, but that also has these requirements. So you sit the IELTS. Ideally, in your 4th or 5th year, you guys should plan to do that, and then as soon. Now, this is very, very, very important. I do want to stress on this, is that when you guys have finished 5th year, okay, this is the most crucial time for you to be planning ahead. Okay, because if you stay still and stay stagnant, I promise you, time will just fly, and you'll find yourself doing nothing. Okay, you'll find yourself sitting at home, you know. So that drive that you have throughout your first 5 years, okay, you need to maintain that until you are somewhere in training or working as a doctor, doing something. That momentum is extremely important, and I can't stress that more, because uni is all fun, you know, it's fun. You study for your exams, you've got everything planned, you've got everyone's help, you've got the support of the staff. Okay, it's relatively easy. Obviously, I'm not trying to downplay the stress of exams. Exams are tough, but you, after uni finishes, you are going to be on your own technically, and the support that you will have will decrease substantially. So you will need to think for yourself. So anyways, moving on. So as soon as you finish your 5th year, what you need to do is apply for the Plab exam. So what I did, as soon as I finished 5th year, the day that I got my pass results, I applied for my Plab exam. Literally, that was the day. And then I celebrated, and then, you know, all that stuff. So you apply for the exam, and you should spend and I think I spent that summer studying. So what happens is, I think that in 5th year, you guys finish in May. So you finish in May, you apply for the Plab, and you take the time out basically to prepare for the Plab exam, while at the same time you would apply to the foundation program. Now this all seems, you know, I can't imagine how this seems to you. Must all sound a little complicated, but it really isn't. Once you guys actually go through the application guidance, you'll have a better idea of things. So pass exams, apply for guys, can you just make sure that your mics are muted? I think at the moment I don't want to name names, so just please make sure that your mics are muted. Anyway, so you finish your 5th year, okay, apply for the Plab exams, and then after that, what you can do is start applying to the foundation program as well. This is obviously, you'll have completed your IELTS exam as well. Now let me explain what the Plab exam is. So it's basically a exam that assesses your clinical and your clinical knowledge, as well as your communication skills. There's a huge importance on communication skills. I believe I did a talk on the importance of communication skills. I think it was last year in uni. Now, so the Plab is split into part 1 and part 2. Some of you may have heard that the Plab exam is about to change, and it's going to become the UK MLA, but obviously you don't need to worry about that, because what you need to focus on is what the exam is now. At the moment, it is the Plab, so there's no need to stress about it changing or whatever. I mean, things have been delayed because of COVID. So I believe that, or I predict that the next three graduating years of students, meaning the current 5th years, 4th years, and 3rd years, shouldn't have a problem. It should stay the same. And even if it changes, you guys will be able to sort that out. No, shouldn't be any issues. So the Plab is split into Plab 1 and Plab 2, right? So Plab 1 is the theoretical part of it, and Plab 2 is the practical or clinical part of it. Now, Plab 1, from what I remember, it's 180 multiple choice questions, and you've got 1 minute to answer each question. Now that seems a little, seems a little scary. You know, you've got 1 minute for each question, but the Plab questions aren't very difficult. So most of what you'll have learned in uni. So if a 4th or a 5th year student is given the Plab exam, I do think a lot of you would know the answers to a lot of the questions. A lot of them are very basic, very basic topics. So you would need to sit the Plab 1 theory exam, 180 questions, and this exam is purely about speed. Okay, so you would need to revise for it. The most appropriate resource that I would suggest would be a website called Plabable. Okay, it's pronounced like Plabable, Plab, able. That is a very good resource that I used, and that basically goes through a lot of Plab questions. It's like a huge question bank, and you just go through and revise those questions. So it's got the question, you answer it, and then it's got like a teaching portion at the bottom. So you can go through that when you've got time. And now that I look back at things, I would definitely say that doing that question bank would really help you when you're actually in your 4th and 5th year. If you're in your 4th and 5th year and you're going through separate rotations, general surgery, you know, internal medicine, all these different fields, it would be very, in an ideal world, it would be very nice to go through the Plab questions while you're doing that. They're actually very easy questions. And when you do them, it really gives you a whole sense of understanding of how to actually manage patients. So have a look at the website, have a look at the exam, and plan ahead if you want to. So that's Plab 1, right? Theory questions. Now that you can sit anywhere in the world. I personally sat it in the UK because those were the only seats that I could find. Now, what you do need to know is that the Plab exam, the seats get booked out very quickly sometimes. So if you want to sit the Plabs, that is why I suggest that you book the exam as soon as you get your pass mark. Right, so you get your pass mark, you sit Plab 1. Second, there's a message in the chat. Yeah, so the source of questions is called Plabable. Okay, Plabable. I'll go through it at the end. Let me just finish the talk, and then all of you can ask questions. Right, so then you sit Plab 1, and for you to be able to sit the part 2 of the exam, you will need to have passed part 1. So you sit Plab 1 wherever you want in the world, you can apply for it. The reason why I sat it in the UK was because I could only get September dates for London. So you go, you sit the exam, and then you've got Plab part 2. Now, as far as I know, the latest information, I'm not sure if it's changed, But Plab Part 2 exam, let me give you a little brief explanation of it. So I believe it's 18 OSCE stations. Much like the ones that you guys have encountered in GMU. Another very good thing is that we have a very good clinical center, you know, the whole cash center. I do think that is a very good center, and you don't realize the importance of these things until later on. So I would suggest that while you guys are in your 4th and 5th year, is that I think the most important sessions are probably the clinical sections, such as the cash. I think you guys call it what was it, PSC, Professional Skills Course? Is that right, Dr. Priya?
Yeah.
So the professional skills course. So those, everything you learn in there, the examination, the way that you do the examinations, taking of blood, all these basic clinical skills that you learn there, these all get reflected in the Plab. So they look at how you do these things. But how it is framed is basically there is a OSCE station. Okay, you have 18 OSCE stations, and each station is a case. So they will present a case to you. For example, you know, you have this lady, she has come in with this. Perform the appropriate examination. So they will tell you, you know, do the examination that's relevant to what she's having, and take things from there. Speak to the patient. You know, it's basically like you are actually seeing a patient. Now they look at everything in like in a general way. So they basically want to see how you would actually be as a doctor as a whole. And this is why communication skills are extremely important. In the UK, the bedside manner is basically how doctors treat patients. Bedside manner is world renowned, which means that there is so much importance on the patient being the center of the care. So everything you do in your practice of medicine or whatever is revolves around the patient. So you always keep the patient in mind. And this reflects in the Plab 2 exam. So they really want to see your communication skills, the way you speak to the patient, how you address them, you know, all these little tiny things like please and thank you. But you know, the English people, they care a lot about these things, you know. It's like putting the cherry on top. All these things, you know, they make a huge difference. You know, the way you speak to them, your tone, all these things make a huge difference, because at the end of the day, if you are the patient, okay, if you are the patient, these things would mean the world to you. How the doctor speaks to you would definitely affect the way that you feel when you're in hospital. Okay, and being a patient is a very, very vulnerable situation. And we don't realize that as doctors, because a lot of us, you know, alhamdulillah, we haven't been that unfortunate to be in a situation where you are a helpless patient, you know, where you are in the care of others. So these things actually have a huge impact, and they make a huge difference on the whole aspect of patient care. I think we've got some mic interference again.
I know. I'm also attending that online thing. No? Yeah? Sure.
All right. So we'll go ahead. So that is the Plab 2 exam. Okay. OSCE stations, a lot of importance on communication skills. Now that is a very good thing. Reason being is because sometimes you can pass the whole exam, okay, just based on your communication skills. So for example, if you've got a patient and you make a mistake, if you start apologizing, oh, sorry, sometimes it'll just pass you on the station. Just because of your communication skills. In fact, just to tell you, I think this has nothing to do with the Plab, but just so you know, is that I believe that there was like a, what was it? I think it was a trial of the Mrcp exam. I don't know if you guys have heard of that. It's the Mrcp is basically the specialty training exam for the UK that a lot of doctors sit down the line. And we had a trial of that in GMU, which was very, very, very beneficial to people who would actually want to sit that exam. I decided to, be part of that trial, and we had a station. And keep in mind, Mrcp exam is not a basic exam. You need to have multiple years of actual clinical experience to be able to sit and pass that exam. And I didn't have a huge idea of what going on, but there was a lady with a medical condition, and this was actually in Cash, in the clinical center. We had a trial, so all of the examiners and stuff were actual doctors, official Mrcp examiners from the UK. And there was basically one station of this lady, and you had to perform a examination. And so I performed the examination, but what I did was, so for that examination, you had to expose, her lower legs, right? So when you walk in, her legs might be covered with something, or she's got like a long dress on, or she's wearing trousers or pants or whatever, you would need to pull them up. Now, what you don't realize as a doctor, it's very easy for you to forget that the patient is a human being. But so I did the examination, and for that examination, I had to obviously reveal the lower part of her legs, which reveals her dignity. So, but when I actually finished doing the examination, I recovered her legs, and I made sure to recover her legs. And when I finished that station, the examiner approached me and he told me that you did the whole thing wrong, which is fine. But he said that I'm going to pass you just because of what you did at the end, just because you recovered her and you protected her dignity, basically. So this just goes to show, or it basically highlights the importance of actually being a doctor is not having all of the knowledge in the world. None of us have that, but the way that you treat other people, the way that you treat your patients, these things are of huge importance. Right, so going back, you do Plab 1, Plab 2 stations, and then in the meanwhile, you are applying to the foundation program. You apply there, and there's another exam called the SJT. So this is another exam which is called the SJT, and what it stands for, it's a situation judgment test. It's a very strange exam, but what it actually is it's very hard to explain. I mean, they will basically give you several situations. You'll have multiple questions, and in these questions you are placed in a situation, and it's not exactly clinical in nature. They actually want to see your judgment skills as a person. For example, you can get asked questions about like things at work. If you have this, your colleague, for example, someone comes in and you can smell alcohol on his breath. They give you 6 options, and they ask you to rate these options from best to worst. So they're basically trying to get an idea of how you are as a person and how you would deal with situations in that scenario. So you sit that exam, and it's funny, but the thing is that exam that you do, the situational judgment test, I've just seen your question. I'll respond at the end. So this whole situation judgment test is actually the exam that ranks you when you prioritize your jobs. For example, you've got a whole list of jobs, and let's say you've ranked your jobs. You will be placed on your list based on your 50% of it is your score in uni, in how well you do in uni, and the other 50% is based on this SJT, which is very different. You know, normally you'd expect that you would get placed based on your theoretical knowledge, but the UK is very different in the sense that they actually want to look at how you are or how you manage or deal with situations at work. So they want to look at your ethics. They also look at your ethical knowledge, and your ethics basically places you wherever you are in the UK. So that's it. So you sit Plab 1, pass that hopefully, and then once you pass Plab 1, sit Plab 2, sit this other exam, the SJT, and then you basically take time out to rank all of the jobs in the UK in the foundation program, which there are many, and then you pretty much start the year later in August. So if I were to give you my timeline, I finished in May. It was about so almost 2 years ago. I finished in May, and I booked my Plab 1. I had already done my IELTS in April, so exactly 2 years ago I did my IELTS, got that out the way, finished 5th year, applied for Plab, spent the summer studying for Plab, and then during the summer the applications opened for the foundation program. So you start your application, and while you are going through the foundation program application, you will have to sit the Plab exam. So you sit Plab 1, Plab 2, and then you rank your jobs, and you find out, and then you start the year later. So the whole actual process takes 1 year, which may seem like a lot of time, but it really isn't. If you look at people in the medical field, you know, one year is nothing. You know, 1 year comes and goes, you know, like this. So that time does fly. So I think that's a summarized version of an actual timeline that you guys can look at. If you do have any questions, I think this is a good time. I don't know how long this call has been going for. So,
Dr. Panda, you want to ask anything, sir?
Yeah, Qasim.
Yeah.
It's not a question, but it's just an information to everyone. First of all, thanks. You know, it was the flow was fantastic, and I think the most crucial aspect. Plab is called Professional and Linguistic Assessments, basically board, and that's what it stands for. And therefore, the linguistic aspect, which you already mentioned about the English language, is you already emphasized on that. I wanted to tell you that you had taken the pilot, what you were mentioning about this one, pilot for the Mrcp PACES examination. Actually, that was what you had attended, if I'm not mistaken. And I wanted to tell you that we are a center now for the Mrcp PACES examination. CASH is the center, Gulf Medical University CASH is center for the Mrcp PACES examination. And in the height of pandemic last year, we did conduct it, but this time it got cancelled because UK examiners could not make it to UAE because they had to go back and sort of, you know, quarantine, and that was a huge issue for them. So they could not spend time. So it could not be conducted this year because of the pandemic. Otherwise, we are a regular PACES examination center officially, where UK examiners come, and we have our local examiners here in the medical department, and Dr. Ihab is the one who is leading this initiative. I'm glad that you emphasized on the importance of clinical skills about the professional skills course, and also on the what are the initiatives taken here. It's much later that students realize that how important they are. So we find that the clinical skills what we give in second and third year are almost forgotten when they come to the fourth year or fifth year. So as a policy decision in the College of Medicine, we have thought that from the subsequent years, there's going to be in phase 3, as soon as they enter into the phase 3, a revisit of all the clinical skills which is required for the students in clinical practice, to give them in a concentrated manner and assess them after when they enter the clinical phase. I hope that's going to help out, and it will also align with whatever you have been talking here about the communication skills and the professional skills, what is most important. And I'm sure this licensing examination in Plab is equally applicable to other licensing examinations, especially USMLE and other licensing, which is skill-based. So just thanks again for emphasizing the important points.
My pleasure.
And when it comes to a person who has actually succeeded in cracking the Plab, it makes a lot of sense, and it carries a lot of weight. Thank you.
Thank you very much. Thanks for reminding me. I would like to say there's a lot I can talk about, but I mean, just like you said, you don't realize the importance of all these things until later on. For example, I think Prof. Hamdi, the Chancellor, would focus a lot on evidence-based medicine, EBM. That was a constant thing that we used to hear, in fourth and fifth year. And we didn't realize the importance of it. I mean, at the end of the day, we were only fourth year medical students. And only later on, when you finish fifth year and you go into different aspects of training, you realize what EBM or evidence-based medicine actually is. And you see that the whole world is moving towards EBM. And the fact that our uni is teaching us these things, it's actually very beneficial. And another thing that I just remembered due to Prof. Manda's talk is basically the portfolio development. When we were, the whole portfolio system started when I was in fourth year. Okay, we were going through fourth year and sitting the exams and doing everything, and then we were told that, oh yeah, you guys are gonna have portfolio, you're gonna have to do this, you're gonna have to do that. And we're like, why do we have to do all this? We were like, why? There's no need for us to do any of this. But only now, later on, now that I've actually come into the foundation year program, you realize the huge importance of portfolio. I mean, you can have done everything. You could have been, the secretary. You could have been part of this program. You could have participated in this procedure and that surgery, but none of it, okay, has any impact unless you actually have documented it and put it in your portfolio in an appropriate way. So I honestly can't highlight the importance of the portfolio development, as much as it deserves. So all these things that you guys are learning in uni, they are very important. So I don't mean for you to stress over them. Don't stress or panic over them. That's not what I'm trying to tell you. What I'm trying to say is that at least learn the importance of these things while you actually are in uni, especially the clinical skills. I do see a question.
Can I say something, Kasim?
Yeah, of course you can.
Yeah, of course you can take your questions. First of all, thank you for a very enlightening presenting talk, and I really appreciate your inputs, and I hope students would have loved it. And I thank you for being my brand ambassador for the EAT portfolio. Remember the one which we had introduced it last year, and hopefully we're carrying it forward. And inshallah, we should be all students are going to start from the year 1 itself, not from the year 4. So there's a very strong message which has gone across. And I think you were also the first person who also did readiness for practice.
Yes.
Remember the readiness for practice examinations, and how do you feel that? How was that assessment a good way you actually now doing it in your real clinical practice?
Yeah. You see, I think 1 hour for this talk was not enough.
Yeah.
It could go on for multiple hours.
Yeah.
But, now that I look back at it, the readiness to practice exam was very similar to what you would get in a Plab scenario, in a Plab 2 scenario. There would be very similar feelings. In the readiness to practice, you are actually placed in a clinical scenario, just like you are in the Plab exams, and you have the chance to actually be a doctor. So the fact that this exam is placed at the end of your 5th year or whatever you guys are planning, I mean, it is very beneficial, extremely beneficial for a person to be able to sit through that exam. I mean, to be honest, it must feel like to the students that you guys are paying me, for everything that I'm saying. But matter of the fact is, it's true. You know what they always say is that you only appreciate something once you've actually gone through and passed it, and that's basically what I'm just trying to highlight. Is that a lot of the things that we have learned has definitely had an impact. I think that it will have more of an impact for the next batch of students who are coming through. And I do want to thank you guys. I mean, it's first of all, it's not easy implementing a new practice, making a change to a program that's been running for so long. It's not easy starting something fresh, especially. So that took a lot of effort from you guys, and I definitely think that should be commended. Because you didn't only have to put the whole measures into place, but you also had to deal with us complaining about it. So yeah.
Yeah, thank you. I just wanted to add, you told something very nice about the value of things. So it's something very dear to me also, I keep telling.
Yeah.
You only realize the value of anything before you get it and after you lose it.
Yeah, that's right.
So maybe not in between when you have it actually. I think we are proud of ourselves. We are the MBBS program, especially one of our signature programs of the university and of the college, which is aligned to the World Federation of Medical Education. We have provided opportunities. From our end, we can provide the opportunities to students, and students must make the best utilization of whatever is available.
Yes.
So that's the message, loud and clear. Thank you for this, to making our students realize it. And if you tell it, I mean, it becomes all the more valuable to them, because you passed through it very recently.
Yeah.
As I told you, as Pankaj was telling, as you were telling, we have the good practice, the clinical skills program, the Center for Advanced Simulation in Healthcare, the readiness for practice and portfolio, evidence-based medicine and research, and all that is there. Communication skills course as such, which is running vertically across the program, research. So all these is available in this one. So it's important to realize it when you are in the medical school and maximize it. And now all are defending the portfolios. The 4th years and 5th years are defending the portfolios, and there's a feedback being given to them. So this is important. Have it on your USB, your portfolio, and then it will be of great help to you immediately after you graduate and you're ready for practice. So that's the whole idea. When we put up so much of pressure on you in the medical program, They just want to make you strong, and it's not to, cause more stress on you and all that. So at the end of the day, it's important that we want you to do better and be, like Qasim.
Thank you. Also, I'd like to say Assalamu alaikum to Prof. Al Sayed, sitting there very quietly, huh?
Yeah.
Alaikum salam. How are you? How are you? Actually, I'm happy and I'm enjoying your speech. Yeah.
Oh,
And I'm really proud of you.
No, I mean, it's very
You
nice.
know, you were very near to me and I'm proud of you.
Oh, thank you very much.
Welcome.
Right. So as Dr. Manda was saying, our deans, our associate deans, I mean, everyone in this talk here definitely has a lot of experience, and that experience, I think, is it's absolutely priceless. You can't put a price on it, and whatever that is being put down, it's all a way of teaching, and we need to try and make the most of the situations that we are put through. And I definitely would suggest all the students that learn from your learn from your supervisors, learn from your lecturers, your doctors, your staff. There's a lesson to be learned everywhere, from everyone. Everyone is able to teach you something, and I'm happy to say that I've learned valuable things from every single one of the staff that you see, over here. I've learned so much, and thank you very much for that. All right, so shall we go ahead?
So many questions in the chat box already. If you want, I can just quickly read them out to you.
No, I've got them here.
I'll the end of the session, but I think we can extend it by maybe 15 minutes more, if you're okay with it.
Yeah, I think this is probably the most important part of the session. So, all right. So, doctor, I've heard that if you cause the patient any pain.
You've already answered the first one.
Yeah, I've answered the first one. So I'm moving on to the second one now. No, so it's not that black and white. His question is that if you cause the patient any pain, you'll automatically fail the exam. No, I don't think that's true. I think at the end of the day, what really matters is how you actually speak to the patient, how you treat the patient. If by any chance you do cause someone pain, just apologize, because they see you as a doctor who is working in the NHS. Now, for example, if I am seeing a patient, okay, a lot of the times, if the patient has a problem or has come in with something, you are going to cause them pain. Okay, I'll tell you, if the person's got abdominal pain and he's got appendicitis, you're going to palpate their abdomen, right? You're going to feel their abdomen. So you're going to cause them pain. And, so no, so they won't automatically fail you.
Haya is asking for a piece of advice you wish you knew before starting med school.
There's several pieces of advice, but I think I would probably say is being proactive. Being proactive in this field is very important, and being consistent in daily tasks. Personally, I'm the kind of person who would let things pile up and do them in one day or cram before an exam, and that isn't how things should be in med school. That's how I was back in high school, but in the medical program, in medical training, being a doctor, you need to take things piece by piece and not overwhelm yourself. So try to be consistent. Something that I always preach is, for example, if you guys have lectures or you have topics that you guys have in a day, these topics, what I would advise is that you review the topic each day. I think that makes a huge difference when actually sitting the exams. And you don't have to spend hours on a day studying for your exams or your topics or whatever. You know, it doesn't have to be several hours of the day. You know, it only needs to be 1 hour, probably an hour. An hour a day you spend reviewing all the topics that you've actually gone through. And then you just do the same thing the next day. It just keeps your mind refreshed, basically. So consistency, all right, and small steps can add up to a lot, as well as being proactive and planning ahead. Planning ahead is also a very good thing. Right, so we'll move on to the next one. 1 year later, you start your foundation program or your residency program. So I'm currently in the first year of my foundation program. Foundation program is a 2-year program where you start as an F1 doctor, foundation year 1, and an F2 doctor. An F2 doctor, obviously, you are more senior. There is more expected of you as an F2 doctor, and you are you're treated very maturely as an F2 doctor. They would expect you to make more decisions or be more competent in a patient's care. All right.
There was a question on from Sana asking you whether the 50% of your application was university grades. Does that mean just 4th and 5th or all 5 years?
Yeah, I see that. Right. So what they basically do is they combine your whole 5 years of university. Okay, all your marks, they get combined by Mr. Shakil, good guy, very helpful guy. He combines all of them, goes through all that effort, and then based on your fully combined marks, you will be ranked amongst your class. So let's say you're 100 people, all your marks are combined, each person, and you have a rank. Okay, so you've got this rank and you are ranked amongst your peers, very competitive, and you are placed in subsections. So in the UK, it's called deciles. So 1 decile is basically 10%. Okay, so if you have, let's say if you're in the top 10 students, you are in the first decile. You're in the top in the first 10%. Okay, that makes you the first decile. So based on that, you get your marks. Obviously, there isn't much of a difference between 1st, 2nd, 3rd, 4th. There's only like 1 point difference. But that 1 point difference, obviously, you know, it can be a huge difference for someone else. So yes, I hope that answers your question. The difficulty of the exam, now the Plab exam really, personally, I'll tell you very honestly, in a very unbiased way, is that the Plab exam really is not that difficult. The Plab 1 material is really not that difficult. That's why I was saying that it would be a good idea to go through to actually go through this question bank during your 4th and 5th year, because you actually enjoy going through it. It's very easy to do these questions. You know, there's a lot of enjoyment in it. So the whole importance of the Plab 1 exam, or the key to passing the Plab 1 exam, is speed. Okay, being able to answer questions very quickly. Okay, so the exam is pretty much a race against time type of thing, and they expect you to know things on the tip of your fingers. You should have all the information. Fine. So we've got the next question. Shall I only provide a letter that I study the program in English? Right. So I would advise that no. The studying the program in English, I think people have tried that. I don't honestly know if it has worked. I would suggest that you go through the official way. you know, especially in the medical field, you should always try to avoid bending the rules. For example, I mean, not bending the rules, but trying to take shortcuts. You need to go through things with the guidance that's been provided. So if we've clearly been told, and it's clearly been mentioned, that you've got to do the IELTS or sit the OET and you've got to get these marks, I would highly suggest that you do those, follow the way that they have told you. And I think it clearly mentions that it clearly mentions that it won't be accepted. If you go through some of the websites, I don't know which website it is, but it has a list of universities which they will accept for studying English, and I don't think our uni is on that list. Obviously, probably because we're not in an English-speaking country.
Yes.
So these things make a difference, right? So
it's not a university. It's US, UK, of course, UK, it's there, and Australia, New Zealand. So these are the ones which are English-speaking countries. So even for Gulf Medical University, admission to the Gulf Medical University, we want IELTS or MSAT or something like that. And the only exceptions, even if you've done your entire schooling in English, is when you are a native English speaker. So I'm sure Plab does not accept it. No. So it's a professional and linguistic assessment board, and therefore the linguistic aspect is there. So they have to submit the IELTS.
Okay, really good talk. Thank you for all the information. My doubt is that apart from Plab scores, how can one increase their chances? So a very good thing about the whole UK system that I wanted to mention, that I've remembered now thanks to your question, would be that there are equal opportunities. Now, I personally, the fact that I'm British, okay, that I have a British passport, made absolutely no difference when comparing me to other people applying to the foundation program. And that is a huge advantage for international graduates. There were certain changes to the laws in the UK system, which basically made every single person applying equal, which means that no matter where you are applying from, this makes you as equal as a UK graduate, for example. And obviously there are only a limited number of seats, meaning however many thousand seats that there are, you know, there would be a chance that a UK graduate would lose a seat and an international graduate would get the seat instead, right? So this is very good for international graduates. Also, another thing that you can do to increase your chance getting accepted into the UK, I mean, you could start working on publications and these kinds of research-based things. But I think during the whole university program, I think actually focusing more on your university studies itself would benefit you more than actually getting a publication. But if you do have the time, I mean, you can spend your summers doing publications, and if you manage to get a publication or your name as an author, that would benefit you as well. So if you have a look at the UK Foundation program at their website, you've got a list of applicant guidance, and in that they provide things that can boost your score. One of them is publications. I personally didn't have a publication, and a lot of people don't have it, and you know, they still get accepted. It's not severely difficult to get accepted into the UK. You just need to be very committed and dedicated when actually doing things. You need to make sure that you have done this at the right time, done this exam at the right time. You know, they're basically, there's a lot of hoop jumping. Okay, so you're constantly jumping through hoops. Okay, and that is how it is in the UK. So let's move on to the next one.
How long they should study?
Yes. Okay. So yeah, good question. The actual study of the Plab, I would say an ideal time period for Plab Part 1 would be about 3 months. I would say would be a good study period. I would aim to do the whole Plab Able, that question bank. I would aim to do that several times. I'd aim to do that at least 3 times. I personally did it 2.5 times. But I would say that you can do that 3 times. There's also another website called PASS Medicine, PASS Medicine. You can go through that one as well. Next question, difference
between NHS trust jobs and FY1.
And FY1. Okay, so the difference is, thanks for pointing this out. There's really a lot for me to talk about, but so an NHS trust job, okay, which is sometimes it's called a trust grade job, sometimes it's called a non-training job. This is basically a position that you would have in the NHS, working as a doctor, but you would be having your role as this doctor, but you wouldn't actually be climbing up a ladder, right? So you get a trust grade job. This means that you would be stuck in that position, and it would be up to you to apply separately for a training job. So you would need to work on your portfolio while doing that job, okay? And then you would have to reapply for a training, for an actual training job, okay? So a trust job basically keeps you at one position. You don't progress, okay? So what I would suggest to all of you, okay, personally, is that you guys apply for start with FY1. Obviously, a lot of people have gone through the trust grade job. A lot of my own friends and colleagues have gone through that position and have gotten training jobs, but it's definitely difficult, you know, and it can be quite daunting and intimidating because you are stuck and you would, there's a lot of pressure on yourself to reapply for a training field. So I would personally, I would suggest that you start from the bottom, FY1, and then go up the ladder. That is the best way, in my opinion, as well as opinions of several people and consultants who I've spoken to. Yeah, so you don't have to do a trust job first. And the thing is, one thing that you guys should know about F1, a very important thing that I forgot to mention, is that for you to apply to F1, you are not to have completed your internship, okay, which is the year after 5th year, you know, you've got an internship year. If you do that year, if you fully complete that year and tell them that, you know what, I've done this year, you won't be allowed to apply to F1. They will tell you to apply to F2. So if you want to apply to F1, you would ideally have to miss your whole internship, okay, and apply for it. So there is a little bit of a gamble when doing that. So it's up to you. You can do your internship, and then you won't be able to apply to F1. You'll either be able to apply to F2 or a trust grade job, which is a non-training job. So it's up to you which way you want to go. But definitely have a look at the website, okay? And everything is very clearly written there, and you can follow that. Right, the next question.
You said most weightage is given to university scores. So what is the importance of Plab exam? How important is the Plab exam itself in ranking?
Ranking, okay, good question. So the Plab exam has absolutely nothing to do with your ranking. And another beauty of the Plab exam is the Plab exam is simply a pass or a fail. That is it. There is no scoring in the Plab, absolutely nothing. The Plab exam is simply an exam that shows that you are capable to work as a UK doctor at a foundation level. that you are able to. So if you want to go to the UK and do a trust grade job, you will have to sit the Plab exam. So you've got Plab 1, Plab 2, it's either pass or fail, and you take things forward that way. Yes.
Okay, the next question basically asks whether that all the theory is done in the preclinical years, the last 2 years are clinical rotations. So wouldn't you forget what you learned in the theory? Do you need to constantly practice it? That's the essence of the question.
Yeah, I'm just reading it. Yeah. Okay, so yeah, so I think what you're trying to ask me is if I've actually had enough time to focus on both rotations, practicing theory things together. But I think the benefit of actually being in a rotation is that you should study what that rotation is actually offering. So when I was talking about doing these Plab questions, when you actually have a look at these questions, okay, you will understand what I've meant. So if you actually have a look at the Plab theory questions, it'll make a lot more sense what I'm trying to say. It's like a theory and clinical question combined, and it's very enjoyable to do. You will not remember everything that you've done. You won't remember your first, second, third, fourth, fifth year forever, okay? But I think the most important thing, especially when focusing on Plab is focused a lot more on clinical things that you learn in fourth and fifth year. So it's very similar to the curriculum that the uni gives us. So when you go through each one, you can do like 10 Plab questions, man. I mean, 10 questions take 10 minutes, 10, 12 minutes. It's really not that much, but it just gives you an idea. It gives you a feel of the exam. And I think that would be helpful. Okay.
Opt for Plab rather than USMLE.
Yes, what made me opt for Plab rather than USMLE? Good question as well. I personally I like the UK healthcare system a little bit more than the US system. What I would say is that both of them have their pros and cons. The US system, as you guys know, the residency system is much shorter than the UK system. Going through the US system, you would become a consultant much faster. But I would say that the US system is much more difficult when compared to other when compared to the UK. The USMLE isn't an easy exam. I'm not going to say that it's an easy exam. The Plab is definitely easier. I think that the UK has a lot more work-life balance. In the US, there will be a lot. It's very grueling. Okay, it's very grueling and very difficult, and there is very little time that you have for yourself. In the UK, there is obviously less time for yourself, but it's manageable. And at the end of the day, the thing is, at the end of the day, if you're in the UK and you're working slowly, you'll make it. You'll become a consultant or whatever. And I prefer the whole healthcare system in the UK. It's more it's more according to my own principles of being a doctor in medicine. Anyways, so next one is from Dr. Pankaj. How much importance is research? So I think I've answered this one already now. Research is gold basically nowadays in the medical field. The reason why it's gold is because you are actually contributing to the medical field, and those are the most esteemed people in the medical field, are the ones who actually improve the medical field. That is the whole idea of it, because you can be the best doctor and be the best with the patients, but what's the point? Because if you're not actually passing this down to other people with research and teaching and all these things. Uh,
Is the foundation program compulsory?
the next one is Dr. Sabihi. Best wishes. Thank you very much, Doctor. I remember you. He's given us some very good classes. I hope you're well. I will keep in touch. And foundation program compulsory. No, so the foundation program isn't compulsory when actually going to the UK. You could technically skip the foundation program and just go straight into go straight into a trust grade job, for example. There are several ways of entry, but I would strongly advise is that as soon as you finish med school, try to just go straight out into the foundation program or whatever it is. If you want to do a trust grade job, a non-training job, I mean, just make sure you get there. Okay, just set yourself on a path that will take you there, because it is very easy to get comfortable after you finished uni. It's very easy to get comfortable, and time will fly. 1 year will fly, 2 years will fly. So yeah, so it's not compulsory, but I would advise it. How is it different from the specialization post-graduation that some students do? Right, so after the foundation program, so like I said, the foundation program basically makes you fully competent. It makes you a competent doctor in the UK, and you are able, if you finished your foundation program, you are able to go in different various specialties and work there as a doctor, meaning you are competent, you have the skills necessary to work in different departments. So if I finish the foundation program, I can decide now, I can do training, I can do, I could take a year out, I could do whatever I want. I could do a trust grade job, a non-training job. I mean, it's up to you. The world's your oyster, basically. After you finish your foundation, you have the skills and the experience. So after foundation, you can come back to the UAE and work as a GP if you wanted to. So it's all up to you. But
university grades affect acceptance to UK.
Yes. So like I said, the university grades do have an impact. Okay, they definitely have an impact. The higher your score would definitely make you give you a better chance of getting accepted into the UK. Like I said, it's not extremely difficult, but at the end of the day, every point counts, doesn't it? So yes, university grades do affect. After passing 5th year, can we apply to FY2? No. So you can't apply to FY2 after passing 5th year. You would, for you to apply to FY2, you need to have completed an internship. Okay. You would need to have completed an internship in very specific departments. There are requirements for that as well. Things become a little more complicated when you try to jump in later on down the line. I personally, a couple of days ago, I was speaking to one of the specialist doctors, one of the registrars, who came in at a specialist level. So I came in as an F1, he came in at a specialist level. So he's a surgeon. And he was basically discussing this with me. He's from Egypt. And he was basically telling me that I had done the right thing, as in stepping in from F1. Things become more complicated the higher you want to jump in. So it's always best to start from the bottom. I've heard teaching experience is a big yes. Teaching experience is definitely a big plus. I have done a lot of teaching. I personally was a tutor back when I was in the UAE. I would be a tutor on the side. So, but definitely you need to have feedback for everything that you do, feedback and documentation. So teaching is like I said, teaching and research. So research is gold, teaching is also gold. So you can do teaching in several different ways. If you can arrange a teaching program, if you can teach amongst your colleagues, voluntary work, charity work, all these kinds of things have an effect. If you want, you can arrange like teaching between your own students. It's a little difficult for you to be able to do that as a student, but I would say if you are able to, it would definitely help you. But the whole teaching experience thing doesn't actually come into play. You don't need to worry about that now. Don't worry about that now. That is something you can focus on later on. They don't expect medical students to be, teachers and all this kind of stuff. Yes, teaching experience is a big plus, but that's later after the foundation program. Knowing the current situation is all the exams get booked really fast, doesn't that put us on a risk of gaps? Yes. Very good point. It does put you at a risk of gaps. Another important thing that the UK really looks at is how many gaps that you have. If you have any gaps in your medical career, they don't want you to have gaps. And for me, I mean, if you're applying to the foundation program, you would ideally, they want to know what you'll be doing in that whole time, in that 1 year of time that you've got. They want to know, what are you going to be doing? So what was my proof? My proof was that I'm studying for my Plab exam. That is your proof of not having a gap. Studying for an exam is considered training. So that is enough evidence for you to show. And yes, so I mean, yes, the exams do get booked really fast. So ideally, if let's say your exam does get booked up and you find yourself having a gap down the line that you don't expect, I mean, do some teaching. You can speak with the university and try to be a tutor, do some part-time teaching, teach the students. You can do that. Do some voluntary work. You can work somewhere in a voluntary capacity at a hospital or anything. I think there are a lot of opportunities out there for you to be able to fill your gaps. Shouldn't be too much of a problem. They basically want to see that you're not just sitting there doing nothing, because when you do nothing, you forget everything. In terms of the US, the university grades are given by.
You've already spoken about it. University grades, are they more important than US is the question?
Oh, okay, fine. So I think I've answered that. Would you say it's much more important in the UK's application? I mean, it's not of huge importance. I would say have a look at the requirements on the website. You will get a much better idea when you actually see that. Can you specialize right after you finish FY2? Yes, you can. So you would do your specialist application after you finish your FY2, or during the FY2, you would apply for specialty training. You do that and then move straight into specialty training. Yes. I heard that doing an internship, getting a job in the UAE, especially, is nearly impossible nowadays. What do you think about this? Is it
about
true?
the DHA, whether you have any info internship and job in.
Yeah, so you're talking more about the UAE here. Now, I mean, with regards to the UAE, definitely, I mean, the medical system in the UAE is improving a lot nowadays. But obviously, the UK is a much bigger country. It has more hospitals, which means it has more seats, right? So that's a bit of a bottleneck in the UAE. Sometimes there can be limitations, and it can get competitive, and there are other issues as well. So yes, obviously, I do think a very high uni grade. So I think at the end of the day, uni grades are of importance. Okay, they are important. You don't just want the degree, okay? And I'm not trying to pressurize you or anything, but I mean, uni grades make a difference, okay, if the difference is small. Okay, because like I said, every point matters.
After F1 and F2, should you have a licensing exam? Yes, Professor Manda wants to say.
Yeah. I just want to take a call here, Qasim, regarding uni grades. Yes, it's important. It's an indicator of how you're going to perform in your subsequent licensing examinations, whether it's USMLE, Plab, or the UAE licensing examination. When you go into the UAE licensing examination, they're not going to ask you what is the uni grade, basically. They adjusted whether you pass the licensing examinations. If you pass the licensing examination, and you'll get a GP license. So uni grade is an indicator of how you're going to perform, right? So although it may be counted, may not be counted. That's a different matter. Qasim has made it very clear that there are percentiles and where there's points for the percentiles in UK system, right? So it's just not getting good grades in uni is going to make your life. No, it's much beyond getting good grades in the uni. Yeah.
All right.
After F1 and F2, can you practice in UAE without a licensing exam?
Yeah, so I think that you can. I think that once you have fully done the foundation program and you've gotten the competencies and you're fully registered in the UK, I think that you don't need to sit the exam.
What extracurriculars have you done? I think you've already answered that in GMU.
Yeah, so extracurriculars in GMU was mainly what was it? Student council, being involved in those kinds of things, student council, global day, these kinds of things. I mean, they definitely look at your extracurricular activities.
How do you practice for Plab 2?
How do you practice for Plab 2 considering it's velocities? Plab 1 is theory. Yeah,
how do you practice?
Yeah, so for Plab 2, it's mainly you would be going through several simulation of cases. Okay, you'd have several OSCE type stations or topics that you would go through and practice with colleagues. And personally, I mean, I personally came to the UK to do like a coaching course for Plab 2. I don't think that's very necessary, like extremely necessary. But I do think that you need some type of orientation to how the Plab exam works. So you could do like a online type of course if you want to. But yeah, so it's basically practicing your clinical skills as well as your theoretical knowledge, practicing OSCE cases.
Was it difficult for you to apply for F1 since you did it in UAE?
Yeah, so I did not complete a UAE internship. That was the thing. So like I said, you would have to skip that internship if you would want to apply. What's the benefit of doing electives? Yes, so benefit of electives. Electives are very important as well. Electives are actually important with specialty training. Okay, so for example, now if I want to apply to a different specialty, for example, I did my elective in surgery. So if I want to apply for surgery, doing that elective gives me extra points. It basically shows the interest of a doctor. You know, it shows your commitment to the field. You know, the fact that you've done an elective benefits you later on down the line. So I would highly suggest doing an elective abroad if you can, or in a specific specialty that you're interested in.
Is there any practice center for Plab 2 in UAE?
Excuse me, doctor.
Yeah, I'll answer your question now. Give me a second. There's I don't know. I think that's something you're gonna have to search online. Have a look online. You might find something, but you don't need to worry about that right now. I think you're going a little too far ahead. once you've actually completed Plab 1 and passed it, then you can worry about Plab 2. But there are several opportunities. You don't need to worry about that. I think someone wants to ask a question on the mic. Someone spoke.
Yes, it's me. It's me.
Hi.
Hello, doctor. Actually, I asked you the question regarding the specialization and the foundation program.
Yeah.
My query is that suppose somebody wants to become an oncologist or a neurologist specifically.
Yeah.
So after you finish 5 years in GMU, if you directly go for specialization in the UK, can you do that, or is the foundation program required for that?
Okay, so if you finish your 5 years, you would need to do your you would need to have some form of clinical exposure after. Now that could either be the foundation program or it could be your UAE internship. If you do your UAE internship and complete that, then you can start to, then technically you can apply to the UK for specialty training. But
Okay.
what you do need to realize is that when going to the UK, okay, from the UAE, from abroad, you will have to provide a lot of things to show that you are that what you have done, okay, is equal to the training that has been done in the UK. Okay, so you will have to show that your internship is the same as what the F1 provides. You know, it'll be complicated in the sense that you'll have to get forms signed off and all kinds of things for equivalency. Basically, you'll be going through equivalency, and that can be a little bit of a challenge sometimes, which is why it's definitely better to go through a proper program. Okay, so you can be more competent as a doctor as a whole in all specialties before going directly into specialty training.
Okay, thank you so much.
All right, no worries.
Okay, there's 2 more questions in the chat box. I think we should wind up with that because we're fast approaching time. Anybody who feels the questions are not answered can mail your questions to me. I will try to get it answered by Qasim, or maybe we can plan for another session also.
Yeah, so
I just answer the 2 questions that are already in the chat box.
Yeah, I'll do that. And I do want to say that we will hopefully, inshallah, we'll be having some more sessions later on down the line. I'm currently speaking with Dr. Manda and Dr. Al Sayed, and we will be planning further on sessions down the line with regards to different topics, some medical teaching as well that we can go through, but more so in an interactive way where we can actually talk instead of it being purely slide based and that kind of stuff. So planning that ahead. Now, right, so the next question, can we get our GP license in the UAE while studying for Plab and then go to UK? Right, so you could do that, okay, but for you to get your GP license in the UAE, you'll need to have completed an internship in the UAE. That puts you in a difficult situation. So you'll have to complete your internship in the UAE, sit the GP exam, get the license. That would probably take you 2 years. During that time, you could do the Plab exam, and then you could apply to the UK. So you could do that, but I mean, it seems very complicated doing that. You don't need to show. I mean, you don't have to work as a GP to show that you're out of practice. To show that you're actually in practice. There are several other things that you can do. Yeah.
Do you know GMU helps us in getting into UAE internship programs, or are we?
I mean, I mean,
this is not a question for
yeah, Qasim.
GMU helps as much as they can.
I thought I had given a talk, and
Yes.
maybe it was not as interesting as Dr. Qasim's because it's not simple. So, Mr. Mohannad, please ask relevant questions to the relevant question.
And if you want to hear Dr. Wanda's talk, it's already uploaded in the Career Office site.
Yes. Okay.
In fact, I've told him to meet me, sir. He can come and meet me, and we can help him out with that.
Yeah. Okay. Yeah.
But anyway, guys, I mean, if you don't have any more questions, I mean, feel free to ask anything. But if you ever need anything, I mean, you've got my email. I think you can get my email from College of Medicine. Doesn't have to be very formal. You guys can message me on social media, on like Instagram or whatever. I'm happy to answer any questions or anything. I mean, keep in touch. If you guys need help, it would be my pleasure to help all of you. I mean, like I said, I want to see, you know, GMU students, I want to see you guys succeed. You know, so that's the goal at the end of the day. So good luck to all of you guys. I hope I've made things a little clear, and just try to stay focused on your plan ahead, on what you want to do after MBBS, and good luck to all of you. And thank you very much for arranging this session. I enjoyed it thoroughly. Thanks for attending. You guys have given me more attention than I gave you in 5 years.
No, our pleasure. Thank you so much. Such an interesting session, right? And I'm sure our students have benefited from it, from your experience, recent experience.
Yeah.
Thank you, and good luck. Best wishes.
Thank you very much. I'll see you all very soon, hopefully.
Yeah, thank you so much, Qasim. Really, it was a very enlightening talk for all of us. Thank you, and hope to catch you soon.
Thank you, Qasim. Thank you very much, and hope you good luck, inshallah.
Inshallah.
And we want to see you soon.
We will see you soon.
Yeah, inshallah.
All right.
Thank you. Thank you.
For the students, I'll upload this recording in the career office site. For those who have missed it and they have mailed me asking me where can we find it, so it will be there. And I have put the feedback form in the chat box, but I don't think you'll have time to. If you can, it's just a small form, so you can fill it. It would be good. Otherwise, I'll mail you the link again.
Thank you.
Thank you, sir.
So,
Thank
so
you,
you want
Doctor.
to make any closing comments?
No, fine. That's fine. Thank you so much for all your efforts.
Okay, the students, as you're leaving, if you can just fill the form, it would be good. The career office site is in Moodle. I have sent you mails asking you to register in that site. It is under the College of Medicine in Moodle.